Hi, my name is Stacy Davis, and I am a family practice nurse practitioner. Today we'll be doing an interview on global health on Haiti. My interviewee today is Michelle, which happens to be my mom. She's actually a retired nurse, 29 years of experience in ICU and trauma, as well as PACU, where she's had the opportunity to volunteer her services in Haiti as well. Mom, thanks for volunteering to do this interview with me today.
You're welcome.
So tell me about your experience with your volunteer services in Haiti. Specifically, I would say, since you had the opportunity to go not too long after the earthquake in 2010 in Haiti.
In 2010, I decided to volunteer to help in Haiti. I was born in Haiti, but I had left there, 40 years, but when I heard about what was happening, I decided it was time to provide some help to my people. So I went with St. Vincent and Baptist that has a hospital in Fond-et-Blanc. And they were going there every year, every 3 months, and since the earthquake, they started going more often. We do oncology, surgery, tumors, and everything. And it happened so in 2015, I was the nurse in charge, taking care of 11 of us, nurses and doctors. It's 5 days, and those 5 days we've done plenty of surgeries, 51 I think, and we only have one surgical room, mind you, from 6 o'clock in the morning, sometime until 1 o'clock in the morning.
So what would you say some of the challenges were in the time that you were there in providing care to some of the patients? Obviously, we know that, you probably were not staffed well enough as one of the issues, but as far as the direct patient care, what are some of the challenges that you found you experienced?
Well, a lot of the challenges is staffing was poor, because we had to assign, 2 nurses in surgery, 2 nurses in pre-op, and there were only 5 nurses. The rest were doctors and tech, and so it was a challenge trying to set up to get them going, because before they go, you have to start an IV, which it is atrocious how they do their start, how things, cleanliness was a problem. But we try to do the best we can.
So you definitely would say that sanitation as well as supplies was a big issue. What about the resources for medications as well for these patients?
St. Vincent, through funds, have provided pharmaceutical that give them stuff, and the way we would do it, as much as we have, we just have a carry-on, and we were allowed 2 bags, and we will fill up our bag with IV bag, medication, whatever we have, we put them on our check-in bag, and all we were allowed is the carry-on, to where everybody is supposed to only have 2 pair of pants and 5 changes, and that's all we had. So we were making it easy for them and cutting ourselves off, just to provide for the needies there.
Now, I can remember in that time that you were there and returning, and some of the stories that you would share with the children, some of them that unfortunately had lost limbs and lost supplies and laptops. Could you share one that definitely made a difference to you in reference to your service there and made you want to move forward and want to do more?
Well, talking about it is just so, it just breaks your heart to see how the kids, they lost a limb, they just no matter what, they're in pain, you're providing for them, and they're so joyful, they're appreciating things. And we were using, whatever we can to, facilitate them moving around. One of the doctors I work with just brought a 18-wheeler and sent it over there to where he was making limbs, for the needies, which was, Dr. Bruderson was just wonderful doing that, and he made it happen for the natives. It was really, really nice that he did that.
That's awesome. That's awesome. Now, as we know, we were approximately 7 years forward, going on 8 since the event had taken place. How do you see that the medical field or resources to medical supplies and services have improved, if they have, or do you believe that there's still a lot more work to do to even get them to where they need to be? When we discuss not only just medical supplies, water supplies, and so forth, what are your thoughts on that?
Well, there has been improvement, but there is a lot more improvement needed, as there was a multimillionaire, I forgot his name, when I was there in charge. I was in a meeting with the higher ups discussing what needs to be done, and there was a multimillionaire, I forgot his name, and he passed. He told his son whatever he left, because he spent a lot of time with the Haitian people to spend there, and he was taking account to build a second surgical suite, which last time I was there was 2014 or 2015, and I heard that second surgical suite has been built. We didn't even we had a patient with a hemoglobin that was going to surgery for a tumor. Her hemoglobin was like 4.3. We have no blood, but it was either do the surgery or let her go. She was bleeding so bad. So we ended up doing the surgery anyway, and all we were giving is iron, plenty of fluid, and she didn't want to do it. I felt so bad. I was in between because she didn't speak English, and they told me to make her have the surgery or else she will die. And I did that, and I was scared to death. But every morning for the 3 days, I went to see her. And that morning, 4 days later, before I left, she couldn't even walk or sit down. But the 4th day before we left, she came to the bus that is taking us she came and gave me a hug and asked me to be the maid of honor in her wedding. She was getting married. She was only 33.
Awesome. So lastly, what would you say that the difference in, because you are a native of Haiti, being born there and raised part of your life there as well, what would you say, from what you can remember, the difference in healthcare from then to now?
Good schooling. I was impressed with the nursing care, but I wish they had more available.
Thank you so much, Mom, for doing this with me. I know it was a little bit uncomfortable, out of her comfort zone, but she was willing to do it for me, so I thank you so much.
Yes, you're welcome.
Definitely look forward to all the changes
success
with Haiti, and continuing to sew into it and volunteer as well. So I hope that all of you all that get an opportunity to watch this video get something to take from it as well. So thank you for watching. Bye.